right, well, good afternoon, everyone. I'm WPTV's Josh Navarro here. We are talking about Omicron and the variant and, answering all of your questions that you may have this afternoon. So be sure to put all of your questions about Omicron and the coronavirus in the comment section. I also want to let you guys know that we are also doing this in Spanish. So this entire conversation that we're going to be having is going to be bilingual. So if you have a Spanish question, be sure to put it in the comment section. If you have an English question, put it in the comment as well. Buenas tardes, les saluda Josh Navarro aquí con la estación WPTV. Estaremos con un doctor en unos segundos y quería dejarles saber que esta conversación va a ser bilingüe en español y en inglés. Entonces, si tienen preguntas sobre el variante Omicron o coronavirus o el COVID, o cualquier pregunta que usted tenga sobre el salud y sobre esta pandemia, le pedimos que le pongas en los comentarios y estaremos aquí contestando las preguntas. We are going to be doing it in English and in Spanish. And without further ado, I would like to welcome in Dr. Luis Peña-Hernandez from the Pulmonary Critical Care and Sleep Disorder Institute of South Florida out of Wellington. Buenas tardes, doctor. Welcome. Thank you so much for joining us today.
Hi, Josh. Thank you very much for inviting me.
All right, doctor. First of all, we want to talk about the Omicron variant and talk to us a little bit about how different this variant is versus Delta and versus, the original, I guess you could say, coronavirus that started spreading back in 2020.
Well, this is a relatively new problem, a relatively new strain that we've had since late November, early December, and came out of South Africa first. And at this point, it has spread throughout the world, literally. At this point, 94.5% of the infections in the US are due to Omicron. The clinical observation that I have in my practice and that has been described is that this seems to be somewhat of a less aggressive variant. However, the transmissibility seems to be a little higher. As you might imagine, this is the result of millions of replications that happen in the human body from all the variants that happened before. Whenever there are those replications, which is almost like copying a file in a computer, have errors, there are mutations. So the mutations of the strains that have the ability to have a more advantageous behavior for the virus are the ones that are going to survive. So that's what we are seeing here with Omicron. Now, it is important to know that, a good part of the world either has been vaccinated or has been previously infected with other variants of COVID. So it is impossible to truly know if this is a less severe variant or what we are seeing is the result of people being exposed to a virus with already some immunity, either from a vaccine or from a previous infections or both. But the fact of the matter is that the clinical observation has been that. However, there are severe cases. There is still risk, especially for individuals who are at high risk. Those individuals at high risk are either people who have no previous vaccination or who have high risk factors or both, or individuals who are vaccinated but have immunocompromised status, such as like transplants, patients with cancer or chemotherapy or things like that. So that's what we have seen so far. It's still a matter of, a lot of research and every day we get information on that.
Ok, doctor Peña, ¿nos puedes explicar sobre las diferencias o si hay alguna diferencia entre el variante Omicron versus el variante Delta? ¿O qué es la diferencia entre los variantes y qué tan peligroso es esta variante que estamos experimentando en este momento?
Sí, entonces es una variante que ha estado presente desde el final de noviembre o el comienzo de diciembre. Y es una variante que se ha visto en la práctica clínica, por lo menos en mi caso personal, pero también en datos que han sido reportados, que no estamos viendo enfermedad tan severa. Más sin embargo, es importante saber que no podemos comparar el grado de severidad con las variantes anteriores porque una gran parte de la población ha sido vacunada y otra parte de la población ha tenido COVID con otras variantes anteriormente. Entonces, lo que estamos viendo es cómo un virus SARS se comporta con muchas de las personas que ya tienen inmunidad de una forma u otra. Más sin embargo, lo que hemos visto es que de pronto no hay severidad tan grave. Hemos visto claramente que las personas que están vacunadas tienen menos incidencia de hospitalización y de muerte. Entonces, es muy importante tener en cuenta que la vacunación de todas maneras protege a la persona. Y en cuanto a la transmisibilidad, parece que esta variante tiene mayor capacidad de transmitirse más fácilmente a las personas de una manera más efectiva. Entonces, eso pues genera que haya más infecciones en un menor periodo de tiempo.
Okay, if you're just joining us, we're having a bilingual conversation with Dr. Luis Peña-Hernandez from the Pulmonary Critical Care Sleep Disorder Institute of South Florida. So you want to ask your questions in English and in Spanish, and we will do the best we can. We have our first question. Joel Kendrick asks, I got vaccinated for COVID, then the Delta variant. Do I need one for the Omicron variant?
So the answer to that question is you don't need a specific vaccine for Omicron variant. What you need is to have your regular COVID vaccine up to date. So if you have had your second dose 6 months ago or greater, then you need a booster. And that in itself will confer protection against hospitalization or death. And we are seeing that patients with who are vaccinated or who have had COVID, like yourself, can also get infected. But what is important is that the chances of dying or ending up in the hospital are lower if you are vaccinated.
Ok, ¿nos puede responder esa pregunta? Si recibí la vacuna del COVID durante la variante Delta, ¿necesito una durante esta variante Omicron?
La respuesta es no específicamente para la variante Omicron, pero lo importante es tener el esquema de vacunación perfectamente completo para COVID. Es decir, las 2 dosis de la vacuna Pfizer o Moderna seguida de un refuerzo, por lo menos 6 meses después de la segunda dosis, para completar 3 dosis. Entonces, esto va a generar protección en contra de la variante Omicron y aún así puede tener la infección, pero los chances de ser hospitalizado o de muerte son mucho menores.
Okay, we're going to have another question from Abraham Segundo. If I'm vaccinated and still got infected and have mild symptoms, am I still contagious?
And the answer is yes, you are still contagious and you want to protect all of those around you who have not been vaccinated or even being vaccinated who have risk factors for severe disease. And the current recommendations say that if you are vaccinated and you have mild symptoms, you should be isolated for at least 5 days, followed by 5 days using a mask. And there has been a lot of controversy regarding that recommendation because some scientific groups consider that it's still important to isolate yourself for 10 days. However, that is the CDC recommendation that is valid currently.
Okay, we're going to go with Patricia Sanabria. Hola, mi pregunta es la siguiente. Yo tengo las 2 vacunas y el 27 de diciembre salí positivo. Ayer ya salí negativo, pero desde el 25 de diciembre he estado con dolor muy fuerte en mis riñones y en un efecto secundario del virus.
Es posible que existan síntomas crónicos después de infección con COVID. No tenemos certeza de que la variante que hayas tenido haya sido Omicron, pero independientemente de la variable es posible que existan síntomas como dolores articulares, dolor de espalda, dolor en las extremidades, que puede en algunos casos permanecer por varias semanas a algunos meses. Entonces, aunque no es posible determinarlo basado en la información que tenemos en este momento contigo, pero es una posibilidad de que eso sea así, de que tengas un efecto secundario del virus.
Okay, doctor, let's answer that question in English. Patricia said that she received 2 vaccines, and on the 27th of December, she tested positive for COVID. And then a couple of days, a couple of weeks later, I suppose, she came out negative, but she still has pain in her kidneys. So, what is the possibility of her case or what she's going through?
So in this particular case, it is still possible that you are experiencing symptoms that persist after the presence of COVID. And even though the acute infection might have subsided, we might still be seeing side effects from the virus. It is impossible to determine with absolute certainty if that's the case. But it is well described that patients who had COVID before can persist with symptoms such as back pain and joint pains and other vague symptoms, neurologic symptoms. Sometimes patients come to my office with asthma-like symptoms, with cough and some bronchospasm, with chest tightness, etc. So the answer is yes, it could well be.
If a person is going through those symptoms that you just mentioned, what do you recommend them do? Do they go see their primary physician as far as like just to make sure everything is okay, or if they need another type of treatment because of the result of being infected with COVID?
They should see their primary physician for a number of reasons, and the most important is not assuming that what you're feeling are symptoms that are result of COVID infection, because you can still have other illness process that has nothing to do with COVID. So you want to go see your primary care physician to make sure that you're not having any other type of disease, but also in certain instances, you can still persist with some chronic symptoms that, you know, we are trying to find a way to treat effectively. So the answer is yes, in short.
Okay, Julie Hannah says we heard so much about lung involvement and ventilators with COVID-19. Is there still so much lung involvement with this Omicron?
Since the first cases that we have in the United States, we started seeing last month, I think it's still a little early to tell, at least the use of chronic ventilator for these patients. However, it is still possible that you can have severe disease that requires the use of a mechanical ventilator. Having said that, as I said earlier, I think we are seeing much less severity of illness with this type of variant. I cannot tell at this point if that's necessarily a consequence of the fact that people have been vaccinated and have been exposed to COVID before, but the answer in short is yes, it's still possible, but apparently we're seeing a little less of ventilator requirement.
Okay, if you're just joining us, with us is Dr. Luis Peña-Hernandez, a doctor out of Wellington, talking to us about Omicron, the coronavirus. If you have any questions in English that you'd like to answer, he will do the best he can to answer it. If you have any questions in Spanish, because this is a bilingual conversation, so if you have any questions in Spanish, be sure to put it in there. Esta conversación es bilingüe. Tenemos al doctor Luis Peña desde la ciudad de Wellington para contestarle las preguntas que posiblemente usted tendrán sobre el Omicron y la coronavirus. Ms. Ruiz says, I was vaccinated and I got COVID. I got the COVID vaccine, doesn't work. So there's a lot of talk about I'm vaccinated. I did the 2 vaccinations. I had got the booster and I still got COVID. And a lot of people still believe that the vaccines do not work. Tell us a little bit about your response to that particular statement.
So that's a very good question. And I'm glad you bring it up because somebody could say, well, how come I had a vaccine and now I have this infection? We have to understand that this disease process and the way that the viruses interact with the human body is very complex. And as I said earlier, these viruses multiply or replicate millions to billions of times in one single individual. So there are mutations. And when that happens, some of these variants acquire the ability to dodge, if you will, the immune system. So in that particular case, we are seeing that some patients are still getting infected with COVID, even though they might have been vaccinated. But that is not necessarily the important take-home message here. The take-home message is if you got COVID and the severity of your disease didn't take you to the hospital, if you recovered successfully and this condition didn't make you require oxygen on a regular basis, if you didn't develop fibrosis of your lungs, or even more so, if you didn't end up in the intensive care unit, in the ICU, on a ventilator, fighting for your life, this in itself makes the vaccine work. So medicine is not perfect. We have to understand that it's not all or nothing. But if I can still recover from a disease, if I can still enjoy my life with my family and have a decent quality of life, that makes in itself the vaccine work.
Dr. Pena, what is your concern as far as with this Omicron variant around the community, as far as hospitalizations and or potentially overwhelming local hospitals?
That is still a concern that we have, and that is still a possibility that we could be facing within the next weeks, because even though I don't think we have seen the incredibly high numbers we were seeing a number of months ago, I think that's still a possibility. So for that reason, I think it's still important to take precautionary measures such as washing your hands and try to, continue to practice some social distancing, wearing a mask, in indoor spaces, etc., so that we can try to avoid transmission. I don't think the pandemic is still over. I am still optimistic that it hopefully will be over within the next 3 to 6 months. I truly believe that, based on the fact that not only vaccines have becoming more used every time, but also the fact that there are medications that are being developed for patients to use at home. And we can talk a little bit more about that if you'd like. But I think the take-home message in this case is that we still have to be cautious, and we have to still take this problem seriously.
All right. Diane asked first, what is the protocol for receiving the monoclonal treatment? Second, why is it being held? And third, are home testing kits medical or hospital grade?
At this time, monoclonal antibodies are in short supply. So for that reason, and there are two significant groups that are getting priority to receive monoclonal antibodies, and these are high-risk groups. One of those is patients who have not been vaccinated and have high risk factors, and then the other one is patients who have been vaccinated but have severe immunocompromised status, such as patients who received the transplant and are on medications to suppress the immune system, or patients who have cancer and are undergoing chemotherapy or immunologic therapy. So it's not necessarily that it's being held as such. It is that it's important to use the resources on those who need them the most, and those are the group populations who definitely could benefit more from them. If we are going to use antibodies on a person who would otherwise have high chances of recovery, then we might be leaving someone who really needed this treatment to save their life outside of the benefit of the medication. Are there home testing kits that are hospital grade? Well, at this point, there are commercial brands that are widely recognized that have a good quality. What we would call hospital grade at this point, I think the most accurate type of test is the so-called PCR. but that test would have to be sent to a lab, and that might take 2 or 3 days to come back. But the important thing, and I'm glad you asked that question, is that the home kit is useful when it's positive, but if it's negative, that doesn't mean automatically that you don't have COVID. If you test negative at home and you still have symptoms, you should still isolate yourself for 5 days and try to get your healthcare provider to give you a PCR test, because that could be a false negative in that case. So it's important that there is a lot of misconception in regards to how to use these tests at home. And people generally think that if they tested negative, they just don't have COVID, period. And it doesn't quite work that way. It's not an absolute result. If you still have the symptoms, if you were in contact with people who have been diagnosed with COVID, you should still take the precautions and assume that you have COVID until proven otherwise.
Okay, doctor, let's answer that question in Spanish as far as the at-home testing kit. Si tomas la prueba de COVID en casa durante esos kits, si tienes una resultado negativa, pero todavía tienes síntomas o te sientes ahí medio no tan 100%, ¿cuáles son las recomendaciones que usted da?
Sí, es importante entender que estos tests no son perfectos y que en algunas instancias el test puede dar un resultado negativo, pero si la persona tiene síntomas y ha estado en contacto con otros individuos que han tenido COVID y que han tenido test positivo para COVID, entonces lo importante es continuar las precauciones de aislarse en casa, por lo menos por 5 días, y tratar de buscar ayuda de su proveedor de salud para ver si pueden obtener una prueba PCR. La prueba PCR es más precisa que la prueba de antígenos y debe ser realizada cuando la prueba de antígenos es negativa, pero aún así hay síntomas que sugieren que el paciente tiene COVID. Entonces, ha habido una concepción errónea en la población en algunos grupos, que si la prueba es negativa, entonces no tengo COVID. Bueno, si hay síntomas y la prueba es negativa, aún podría haber una infección por COVID y habría que hacer la prueba confirmatoria con el PCR.
Okay, we have another question from Rolando Barrero. Does blood type play a role in COVID-19?
So that's a very good question. At the very beginning of the pandemic, there was some data that was suggesting that patients with different blood types would have different severity of COVID infection. However, to my knowledge, there is no further strong body of evidence, so there is not further data that confirms that that's the case. In some instances, there are some pieces of information, some research studies that are done on small populations, and we cannot generalize the results or make conclusions that that's the case. So the short answer would be not necessarily.
Okay, le podemos contestar en español de la misma manera si el tipo de sangre que tienes tiene el mismo impacto si agarras el COVID-19.
Sí, básicamente si los diferentes tipos de sangre generan diferente tipo de severidad en la infección por COVID, y sí existieron algunos reportes publicados, sobre todo al comienzo de la pandemia, que sugerían que había una diferencia en la severidad de la infección dependiendo de diferentes tipos de sangre. Más sin embargo, que yo sepa, no ha existido una prueba real y objetiva que este sea el caso en la población general. Y hay que entender que en muchos casos hay estudios pequeños que se publican que muestran algunos resultados, pero si la muestra es pequeña y si no existen otros estudios que confirmen estos resultados, no se puede hacer la generalización de que este es el caso. Y yo creo que este es uno de los ejemplos de eso.
Let's go to testing. Who are the people, doctor, that should be tested? If you're just joining us today, right now, joining us is Dr. Luis Peña-Hernandez from the Pulmonary Critical Care and Sleep Disorders Institute of South Florida out of Wellington. having this conversation bilingual in English and in Spanish. So if you have any questions, send them in English. Si tienen preguntas en español, mándalos en español. Somos bilingüe aquí, lo vamos a contestar la mejor posible. Who are the people that should be getting tested? You know, we're seeing all these long lines everywhere. Everybody's wanting at-home test kits. If you've been vaccinated, you don't feel any symptoms, should you get tested on a regular basis, or what do you recommend?
There is no reason to recommend that people get tested on a regular basis. However, people who have symptoms that suggest the presence of COVID, such as sore throat, headache, sometimes diarrhea, abdominal pain, generalized body aches, or fever, especially in those patients who have been exposed to other people who have been confirmed to have COVID. Those individuals should be tested. Later on in the infectious process, 3 or 4 days later, patients who have COVID start developing characteristically shortness of breath and sometimes also dry cough. So those patients should get tested, or if there is an exposure. So I went to a gathering last weekend, and 3 of the people that I was in close proximity with were tested and were diagnosed with COVID. Then I think those individuals should get tested. Who should not get tested? If you are asymptomatic, and if you just want to get tested just to know, just because, but you don't really have any significant exposure and you don't have symptoms, there is no reason to be tested. Now, if for some reason people have been trying to get tested, have been in line, and they get dismissed because there is just no more test available. But if you're experiencing symptoms, I think those individuals should still keep the precautions in place and, isolate at home and assume that you might have COVID. So it's important to keep that in mind. It's a difficult moment just because the availability of tests has not been enough for the demand at this point. However, those are the basic principles that people should follow, or as common sense says, well, you have to communicate with your primary care provider and determine if you need to be tested or not.
What about for people who have done international travel? Should they get tested, or even traveling within the United States, packed at airports, and or their business is always out of state, they're always in and out of the airplane? What do you recommend as far as testing goes for those individuals?
The CDC and each country has their particular guidelines because it differs it's different to the different parts of the world where you're going. If you're coming from an area of high prevalence to an area of low prevalence, then you should probably get tested. And when people go to family gatherings, you're gonna meet your family, and there are people who have chronic illness with significant risk factors, especially elderly population, then maybe you should be cautious and get tested in those particular scenarios. However, it is a very particular situation when you have to look at all the factors and make a determination.
Ok, podemos contestar esa pregunta en español. Si personas viajan internacional, especialmente si vamos a visitar nuestras familias en Centro y Suramérica o el Caribe o México, o personas que viajan a otros estados por el trabajo, el tipo de trabajo que tienen, ¿qué recomienda sobre qué tan a menudo ellos deberían de tomarse la prueba contra el COVID?
Sí, cada país tiene una regulación diferente y una serie de recomendaciones, entonces habría que ir a la página del CDC y determinar si la recomendación está en este momento válida o no, porque si se viaja de un área de alta prevalencia a un área de baja prevalencia, sería importante hacer un examen y un test. Pero todo realmente depende de la regulación que exista y las reglas con el país de origen y el país de destino. La otra situación es En cuanto a viajes domésticos, sí debe haber un test. En este momento no hay el requerimiento estándar de que hay que hacerse un test. Más sin embargo, si una persona va a visitar personas de su familia o amigos que tienen la vulnerabilidad a estar severamente enfermas, personas de avanzada edad o personas que tengan enfermedades crónicas, entonces se debe consultar con el doctor de cuidado primario y determinar si es necesario hacer una prueba o no.
Um, ¿Qué es lo que piensas? ¿Por qué hay tantas personas que estamos viendo que se están haciendo en línea, como vemos en el video, que ya se están tomando la prueba a números récord versus antes, durante el Delta, durante el variante Delta? Estamos viendo demasiada gente tomando estas pruebas. ¿Qué es lo que piensa que está motivando a la gente a ir a estos sitios?
Hay una serie de factores, uno de ellos es el hecho de que acabamos de pasar la época de fiestas, entonces muchas personas han estado viajando y encontrándose con sus familiares y amigos y obviamente existe la necesidad a ese nivel. Dos, el hecho de que la variante Omicron se ha diseminado de manera muy rápida en las últimas semanas y eso obviamente ha causado un aumento en el número de infecciones que hemos visto en todo el mundo y obviamente en los Estados Unidos. Hemos visto una gran cantidad de infecciones y una incidencia increíblemente alta durante las últimas semanas. Entonces, obviamente, hay más personas que están presentando síntomas y estas personas están buscando la forma de determinar si lo que tienen es COVID o de pronto lo que tienen es una gripa común, lo cual también puede ser el caso. Lo otro es eh, al haber personas que tienen COVID confirmado, entonces pueden existir lugares de trabajo que estén requiriendo que personas tengan una prueba negativa para poder venir a trabajar. Entonces, estamos viendo una serie de factores que hacen que la demanda por pruebas sea muy alta en este momento. Entonces, yo creo que eso es lo que está ocurriendo y pues es entendible, ¿no?
Okay, doctor, just one last recommendation for folks. You know, a lot of people say, I got vaccinated, I got the booster, I still got tested. What is, I guess, a big take home message as we're coming to end this conversation this afternoon?
The take-home message is take COVID still seriously, even though apparently the last variant, the Omicron variant, seems to be less severe. Number two, vaccination can still save lives and can save you from ending up in the hospital or with severe chronic disease, especially in your lungs. And number three, continue to practice some general precautionary measures such as, hand washing and maybe social distancing and using a mask whenever you're going to be in close proximity, especially with crowds. I think that would be the take-home message. At this point, I think we are much more equipped with a lot of tools to fight this infection. There are incredible patients coming down the pipeline of a couple of big companies. I think that is going to be a game changer. But in the meantime, we still have to keep our guard up.
Ok, en español, unas recomendaciones mientras ya que vamos a cerrar esta conversación esta tarde.
Claro, en este momento es importante tener en cuenta que el COVID aún sigue siendo un problema de salud pública, que todavía hay que tener las precauciones necesarias para evitar ser contagiados, porque las personas pueden tener una reinfección, así hayas tenido COVID o anteriormente o te hayas vacunado. Hay que tener en cuenta que la vacunación salva vidas y disminuye la incidencia de personas que terminan en el hospital. Entonces, vale la pena vacunarse, así se haya tenido COVID anteriormente. Y así las personas vacunadas estén teniendo COVID actualmente. Y lo último es que hay una serie de intervenciones y de medicamentos que van a salir, que valen la pena, van a cambiar mucho la forma en que se maneja el COVID. Hay medicamentos orales que van a venir probablemente en los próximos 2 o 3 semanas. Y yo creo que el el panorama para el futuro, en mi opinión personal, es positivo, pero en este momento hay que mantener la guardia en alto.
All right, Dr. Peña-Hernandez, thank you so much for taking time. Muchas gracias por tomar este tiempo esta tarde, for taking time this afternoon to talk to us and answer the questions. Thank you so much for taking time.
Thank you very much for inviting me, and I appreciate it.
All right, if you like this video, click like and share the video on all your social media platforms. Of course, we'll have a wrap up later today on WPTV. Thank you so much for joining us, and we'll see you next time.